I'm Canna Hyde, and this is my speech for the 2022 Washington State Tournament. When I was in early elementary school, I could not make it through a single day without a meltdown. And by a meltdown, I mean kicking, screaming, throwing things, and hiding under tables, sobbing. I hated it. It was so embarrassing that I couldn't seem to keep it from happening. In third grade, I was diagnosed with generalized anxiety disorder. So many things made me anxious. If a classmate didn't sanitize his hands before lunch, I was worried that he would get sick. If the playground duty said something was a rule, but they didn't enforce it, I got angry. It was a huge burden. I started cognitive behavioral therapy, but the anxiety was still there. Not long before I turned 10, I met Cowboy and Coco. They are therapy horses with Trot, therapeutic riding of Tri-Cities. As I learned to control horses, I learned to control myself. If I was out of control, the horse would obey me, just like my body when I'd have a meltdown. Slowly, I began to improve. I went from multiple meltdowns a day to only one every couple of days. Horses have been used in human therapy for years, for multiple needs, physical, mental, and emotional. So let's saddle up and walk on to understand the types of horse therapy, trot onto a therapy session, and canter through the story of a horse helping a human. According to the Professional Association of Therapeutic Horsemanship, PATH, there are many kinds of equine-assisted activities. Basically, anytime a human interacts with a horse, that could be called an equine-assisted activity. But we're going to get a little more specific. PATH says equine-assisted therapy is a treatment which uses horses to reach rehabilitative goals that are bounded by a medical professional scope of practice. To get even more specific, equine-facilitated psychotherapy is always overseen by a licensed mental health professional. Interestingly, these therapies rarely involve actually riding the horse. Let's face it, some people are afraid of these 1,000-pound animals, but because horses are herd and prey animals, they are sensitive to emotions. If you approach a horse with anger, it will shy away. Horses never hide their feelings. That means they can help reflect back what therapy patients are feeling, enabling a therapist to probe deeper. This has been useful in treating returning veterans and helping them to recover from emotional trauma and regain their ability to connect with others around them. Since it often takes place outdoors or in a farm setting instead of in a clinic, it is also useful to those who find fear or shame in being in a clinical setting. For patients who need other therapies, there is hippotherapy, which is what I participate in. The article Horses Really Are the Best Therapy states, it's a form of treatment used within physical, occupational, and speech therapy, utilizing the movement of the horse to provide carefully graded sensory, neuromotor, and cognitive input to the patient. In other words, being on horseback stimulates both mind and body. Many people see horseback riding as just sitting on the animal's back and steering a little, but they are mistaken. It requires balance, core strength, and leg strength. As the horse moves, the rider is constantly adjusting to its rhythm and balance. According to Trot, our riders include those with cerebral palsy, muscular dystrophy, multiple sclerosis, or head injury, as well as recovering stroke patients. Areas of improvement for these riders may include joint range of motion, muscle strength and tone, coordination, balance, and sensory integration. For people with autism, learning, behavioral, or emotional disabilities, interaction with a horse can help improve self-confidence, patience, emotional control and self-discipline, social interaction, and communication. Now, let's pick up some speed and trot into how one of these riding sessions looks. The horses used in therapy programs must be calm and patient, and should have a smooth gait. These horses have been trained to work with riders who may have poor balance or motor difficulties, and to accept riders from mounting from a block or from a wheelchair ramp. Before a rider ever gets on a horse, the rider is evaluated and matched with a horse with the right body type for them, and the right saddle and bridle. Most riders do not use a bit to protect the horse's mouth. Riders mount from a mounting block. Those in wheelchair ramps can use a ramp up to the level of the horse's back and are assisted in mounting from there. Depending on the rider's needs, they can have helpers, 1 or 2 sidewalkers to help them stay upright and steady in the saddle, and a leader who leads the horse using a rope clipped to its bridle. Generally, all three of these people are volunteers for the organization. They stay close to the rider. When the horse walks or trots, so do the humans. Riders who are physically able may just have a leader. My leader usually unclips early into the session, unless we are doing something unusual, like riding bareback or even sitting backwards on the horse. A session usually includes 2 to 5 riders grouped by ability, although scheduling can be complicated some by having the right horse for the right people at the right time. One of my riding buddies has been with me for 2 years now. We have similar needs, interests, and riding abilities, and we have become friends outside of riding as well. We start with warm-ups, working on flexibility and balance in our saddles. Most of the time is spent on riding skills like walking, guiding the horse around obstacles, and trotting. But we have been able to go on trail rides and through a sensory course as well. After a lesson, riders who are interested and able may help with taking off the saddle and bridle and grooming the horse. I love grooming. Curry-combing a horse is very soothing. Now that you know how a therapy session works, let's canter onto one of the most famous cases of a horse helping to rehabilitate a rider. In the 1940s, a woman named Liz Heritel was an international-level equestrian from Denmark. She competed in dressage, an event where horses seem to dance as they perform different movements. If you've ever seen the dancing horses during a Cinco de Mayo parade, it is very similar. Liz became ill with polio. Her baby was safely... During her second pregnancy, Liz became ill with polio. Her baby was safely born, but Liz was completely paralyzed. With help from her mother and husband, she was first able to move her arms, then crawl, then walk with arm crutches. Liz wanted to ride again. With her horse, Jubilee, she slowly regained her proficiency in the saddle. She fell a lot as she first learned to balance. Dressage is based on subtle cues from the rider's legs and hands, and Liz and Jubilee had to learn new cues that didn't require pressure from Liz's legs. 3 years after Liz became ill in 1947, she was competing again. No one knew about her condition. Her scores in international competition that year were good enough to qualify her for the Olympics. But, according to Horse Nation, it was not her disability or her skill that prevented her from competing in the 1948 Olympic Games. Women were still not allowed. It would be another 4 years before the gender bar was lifted, and Liz would represent Denmark in the 1952 Helsinki Olympics. Liz was not able to get on or off her horse without help. Still, no one knew about her disability. She rode so well that she won the silver medal in dressage. She was the first woman to win an Olympic medal in an equestrian event in the first year that women were able to compete. Horse Nation tells us, in one of sport's finest hours, the gold medal winner, Henry St. Cyr of Sweden, carried Liz from her horse to the Olympic podium. It was said to be one of the most emotional moments in Olympic history. But that wasn't her proudest accomplishment. Neither was her medal at the following Olympics, or being a national champion and hero. She was the most proud of opening the first therapeutic riding center in Europe. Her advocacy of people with disabilities riding was one of the major forces for making therapeutic riding an accepted rehabilitation. Whoa! Horses really are amazing creatures, and they can have powerful effects on humans. We walked through the basics of equine-assisted therapy, trotted through a session, and cantered around the story of Liz Heritel. It's been a few years since I started my horse therapy journey. I'm more mature, and I'm able to accept that sometimes people don't wash their hands before lunch. I still have my difficult moments, though I haven't hid under a desk at school for years. Thanks to my friends Coco, Cowboy, Cujo, and Locke, I've come a long way. Thank you.